Histology, tissue preparation and staining. Assalamu alaikum everyone. Today, we will discuss histology, tissue preparation and staining. Histology is the branch of biology and medicine that deals with the microscopic study of tissues. Since most tissues cannot be properly examined with the naked eye, special techniques are used to prepare tissue samples for microscopic observation. The process involves several important steps including tissue collection, fixation, dehydration, embedding, sectioning, and staining. These procedures preserve tissue structure and make different cellular components visible under a microscope. Histology plays a vital role in medical diagnosis, pathology, research, and medical education. Through histological examination, doctors can identify diseases such as cancer, infections, and tissue abnormalities. In this presentation, we will learn how tissues are prepared and stained before being examined under a microscope. What is histology? Histology is the scientific study of the microscopic anatomy of cells and tissues. The word histology comes from the Greek words histos meaning tissue and logos meaning study. The main purpose of histology is to understand the structure and organization of tissues and organs. It helps scientists and doctors observe how normal tissues look and identify abnormal changes caused by diseases. Histological examination is commonly performed in hospitals and pathology laboratories. For example, when a biopsy is taken from a patient, the tissue is processed and examined microscopically to determine whether cancer or another disease is present. Histology is therefore essential for diagnosis, research, and understanding human anatomy. Tissue collection and fixation. The first step in tissue preparation is collecting a tissue sample. Tissue samples may be obtained through surgery, biopsy, or autopsy. Once removed from the body, tissues begin to deteriorate because enzymes and bacteria start breaking down cellular structures. To prevent this damage, tissues are immediately placed in a chemical solution called a fixative. The most commonly used fixative is 10% neutral buffered formalin. Formalin preserves tissue architecture by stabilizing proteins and preventing decomposition. The objectives of fixation are: prevent tissue decay, preserve cellular details, maintain tissue structure, prepare tissue for further processing. Without proper fixation, tissue samples may become distorted, making accurate diagnosis impossible. Steps of tissue preparation. After fixation, the tissue undergoes several processing steps before microscopic examination. 1. Fixation. Preserves tissue structure and prevents decomposition. 2. Dehydration. Water is removed from the tissue using increasing concentrations of alcohol because wax cannot mix with water. 3. Clearing. Alcohol is replaced with a clearing agent such as xylene. This step makes tissues transparent and prepares them for wax infiltration. 4. Embedding. The tissue is infiltrated with molten paraffin wax and placed in a block to provide support. 5. Sectioning. Very thin slices of tissue are cut using a microtome. 6. Staining. Special dyes are applied to enhance visibility of cells and tissue structures. These steps ensure that tissue samples can be examined accurately under the microscope. Embedding and sectioning. Embedding and sectioning are critical steps in histological preparation. During embedding, the tissue is surrounded by molten paraffin wax. Once cooled, the wax hardens and forms a solid block that supports the tissue. The embedded tissue block is then mounted on a microtome, a precision instrument used to cut extremely thin tissue sections. Typically, sections are cut between 3 to 5 micrometers thick. Such thin sections allow light to pass through them, making microscopic observation possible. The sections are carefully transferred onto glass slides and prepared for staining. Good embedding and sectioning techniques are essential because poor section quality can interfere with diagnosis and microscopic interpretation. Hematoxylin and Eosin, HNE, staining. The most widely used stain in histology is hematoxylin and Eosin, HNE. This staining method provides excellent contrast between different tissue components. Hematoxylin. Basic dye. Stains nuclei blue or purple. Binds to acidic structures such as DNA and RNA. Eosin. Acidic dye. Stains cytoplasm pink. Colors connective tissue fibers and extracellular proteins. Because of this color contrast, pathologists can easily distinguish cells, nuclei, connective tissue, and many abnormalities. More than 90% of routine histological examinations use H&E staining because it provides a clear overview of tissue architecture. Special stains. Although H&E staining is very useful, some tissue structures require special stains for better visualization. PAS, periodic acid Schiff, stain. Used to detect glycogen, mucus, basement membranes, fungal organisms. Masson's Trichrome stain. Used to identify collagen fibers, muscle tissue, fibrosis and scar tissue. Silver stains. Used for reticular fibers, nerve fibers, certain microorganisms. Ziehl-Neelsen stain. Used to detect acid-fast bacteria, especially Mycobacterium tuberculosis. Special stains help pathologists diagnose specific diseases and identify structures that are not clearly visible with H&E stain. Importance of tissue staining. Tissue staining is one of the most important steps in histology because unstained tissues are nearly transparent and difficult to examine. Staining provides contrast between different cellular components and highlights important tissue structures. The benefits of tissue staining include improved visibility of cells and tissues, easier identification of tissue organization, detection of infections and abnormalities, accurate diagnosis of diseases, better understanding of microscopic anatomy. Pathologists rely heavily on stained tissue sections to identify cancers, inflammatory conditions, infections, and degenerative diseases. Without staining, microscopic diagnosis would be extremely difficult. Quick revision. Let us quickly revise the important points discussed in today's presentation. Question 1. What is the most commonly used tissue stain? Answer: Hematoxylin and Eosin, H&E. Question 2. Which chemical is commonly used for fixation? Answer: 10% neutral buffered formalin. Question 3. Which instrument is used to cut thin tissue sections? Answer: Microtome. Summary. Histology is the study of tissues under the microscope. Tissue preparation includes fixation, dehydration, clearing, embedding, sectioning, and staining. Formalin preserves tissue structure. Microtomes cut thin tissue sections. H&E is the most commonly used stain. Special stains help identify specific structures and diseases. Thank you. Any questions?